dorsal,
The dorsal leg up.
dorsal recumbent.
Dorsal
Leg up.
Head as flat as they can tolerate. Some patients cannot tolerate being flat, but we have a very good patient today. She can tolerate being flat. What about the position of our bed?
Comfortable working height.
Comfortable working height. Jenny, tell me when it's comfortable working height.
I'm pretty
Okay. What's very important about a patient at a catheter? Even though they may be in a private room, we always want to pull the curtain, okay? Because people can walk in the room and then there they are. We always want to keep them covered well.
Can I interrupt for a second?
Mm-hmm.
The other thing is, remember professionalism. Sometimes patients say things
That's right.
that, you know, maybe they're embarrassed, they're trying to cover it up with what they think is funny. You maintain professionalism at all times.
And you guys, if patients get really crude with you, I've had male patients get really crude, and I just say, that's not appropriate. We're not talking about that. I'm gonna do to get you some relief and drain your bladder, and that's what I'm here to do. So, you have. So in the video, it shows you draping their legs. I've never done that in practice because I contaminate my field every time I try to do that.
Yeah.
But just keep them covered as much as you can, okay? All right. They're in position. You'll bring a towel, washcloth, because you'll always do peri-care, and it says that on your sheet, so you'll verbalize to us during the checkoff, is that, okay, I would do peri-care. And I will tell you why I'm doing peri-care with the towel and washcloth, because I don't have to be sterile to do that. I'm looking why I'm doing peri-care, okay? So I'm spreading and I'm washing, and I'm also looking to see, because you guys, everybody is different. So I'm also looking why I'm doing peri-care. All right, so dorsal recumbent. We've moved and have the top half all covered. We've completed peri-care, got them all cleaned up. We've told them that we're gonna put in a Foley, but we also need to do what? Palpate the bladder, which is right over the symphysis pubis here. And you guys, you palpate gently, because if somebody's really distended, they are very tender, okay? That bladder's sitting right there, so the bladder may be distended up into here. But you just palpate gently how far your bladder is distended, and that's going to tell you whether you're ready to cap. So they do have a very distended bladder that's very tender, and so now we're ready to cap. Open the other end, flip it around. Here, this from the back. There you go. These open
Well, now I
different.
have two openings, so I'm just gonna.
Is this a sterile procedure? Yes, it is. Have your trash can close to you so you can just drop in. So we have a very compliant patient. Whoop, Jenny, whoop. We're gonna do this between their legs because we have a very compliant patient. Bring your sterile. When you're opening a sterile field, which way do you open first? Away. So flip your box. There you go. Open your sterile field. Remember, you have a 1-inch border around. So you do have to kind of grab and keep pulling at your sides to keep it from folding back on each other. So this is where I'd say take a picture and say your gloves are on top. Then we have our drape, and then we have a fenestrated drape that I have never used and you will not have to use in the checkoff, okay? You can do this one of two ways. You can take your sterile gloves and put them over there. And you can either put them on now And so you guys, you also have to have your partner watching, and you keep an eye out too, that they don't kick your sterile field or anything like that, okay? These gloves are very cheap, and so they do rip easily. Yep, like that. So during checkoff, Jenny, you would be in trouble because you're contaminating that sterile glove.
Yeah. I
So
realize that.
that's part of checkoff, is putting those sterile gloves on correctly. There you go.
When it ripped, it like threw me off.
All right. Now we have this sterile pad here that will go shiny side down. So I'm gonna just back us up a little bit because we need to put that pad in there. Pick your pad up.
Shiny side down.
And it's hard to tell on this one.
It is.
This is the shiny side here.
Okay.
But I'm gonna show you something with this one because you won't use this one. This is the fenestrated that usually goes there, but doesn't go there.
Never
Jenny?
used it.
So I want you to put your hand like this, wrap your hand, and go in. And do you see what that does? That's protecting my sterile gloves from being contaminated. I put it in and I get out. You don't have to make it pretty, okay? Because you do not want those gloves to touch anywhere there and be out. We've still got our pad down. We're good to go. Okay. The other option is Jenny take and put her sterile gloves over there, then pick up this pad by just our 1-inch border and lay it down like that and get out. But what a lot of people were doing today was they did that with non-sterile gloves on, and then they forgot to go put their sterile gloves on and they started to open without gloves. This is all sterile. So either way is right, as long as you maintain sterility. All right? All right, what's next, Jenny?
Open our packets.
Open our packets. There are two, they are simulated swab sticks that you can use because they're just distilled water. Sometimes you will see cotton balls with, I just went away, iodine that you pour on and use, or there's iodine swab sticks, but you can't use iodine on these. There are 2 packs. I recommend just opening one for practice, so Jenny, just set that one aside. Okay. Remember, you're going to contaminate one hand. So I take mine out and lay them here.
Like touching them?
You can touch them, pull them out, and put them in there. And then that goes in your trash. There you go. All right. There is a lubricant in here that you would next open and squirt. But you guys, we can't use that lubricant on these. So if you'll hand me that thing of lubricant right there. So your partner will spray some lubricant in there for you. This also, on your bag or on the package, it tells you this is a 14 French with a 5 ml balloon. How much saline do we have in our syringe there?
10.
Yeah, I'm not sure why they put 10. So we need to squirt 5 of that out. So take your cap off and
Where?
squirt 5 ml out in the trash. That's what everybody's responding. Whoop! Okay. So now put that back right in there. It's still sterile. Now, take your top container off. You can put it here. The reason I didn't have her put it here, we'd now be outside our sterile field, okay? Pick that up. What do you think that's for?
To collect urine.
To send a sterile specimen. We don't have an order to do that. We don't have to do that, so we don't need that. So put that over there. Now, pick your bag and your catheter up here. So you guys, you'll see this here is what you drain the urine out of the bag, and it's up and it's closed, so we don't have to worry about that. So leave your bag down here. Cause what you need to get to, Jenny, is that green port to put your syringe on. But do not pull this all the way off. Just take it off far enough that you have access to your, okay. Now, put this down, back down in, because we want to protect our catheter. Get your syringe and hook her onto your green port there. And push hard because it's a hard push. There we go. Okay, now we've got that ready. That'll blow up our balloon. We're ready to wipe. We need to take this cover off and lay our catheter in our lubricant. Be very careful taking it off that you don't just pull it off and the catheter go peep and hit the leg, hit something non-sterile. So pull it off slowly, guiding up. You can wrap it in your hand, just whatever you need to do. Jenny, you drop that over because that's out of your sterile field now. And she's gonna lay that in her lubricant. Now, does it look like you're ready to start washing? You ready to clean? Because remember, you're gonna contaminate one hand. So it looks to me like she's ready to go. She's gonna contaminate one hand, spread the labia, which they don't spread.
Yeah, that's what I noticed.
So just, yeah, go on the outside like that. She's gonna clean. How do we clean?
We start around and then go towards out. Start in and then go.
That's on a male.
That's a male.
Oh,
Top to bottom.
So on a female, top to bottom, left side, right side, down the middle.
right.
All right.
And then left side, right side, then down the middle.
Uh-huh.
How do we do this if it's not actually just go on the outside?
Mm-hmm. Yep. And pitch. Do not go over your sterile field. And pitch. See why I say you have your trash can like right there? There you go. Never take the dirty back over your sterile field. All right. Right side.
Oh, these are the ones I have.
No, you got another back. And pitch.
And down the middle.
And down the middle. Uh-huh. You guys, she must maintain the labia apart. What happens if she lets go?
It becomes unsterile.
And you gotta do it all over again.
Yes.
Okay, but she's got it open. We're good to go. She's ready. And believe me, your fingers get tired. She's ready to insert. Can you see?
Yeah, there's two.
Yeah, there's two.
Top one.
Top one. Hold it close enough that you have good control, but not so close that you're gonna contaminate your hand by touching the labia.
Yeah, it's harder at the tip.
Yes, it is. It's
Okay.
different. Alrighty, we're ready. She moves her hands back.
It's
And this-
pulling, yeah.
Yep, you gotta make sure that comes out of your box so it doesn't pull. Alright, hold on, don't let go. You see urine. After you see urine, what do?
Get a little farther.
You advance another inch. So advance another inch. Alright. Now, she's advanced another inch. So she's there. Take this hand and hold on to your catheter. Because this sterile part is now in. This is all non-sterile now.
Mhm.
Blow up your balloon. Push. It's a hard push. Lots of pressure. Keep pushing, because if you let go, that fluid's coming right back out, okay? So you keep pushing. On this hand, you're gonna pull out a little bit and say, yep, it's there, and then put it back in just to your fingers, okay? Now you can let go. We're done here. Come grab a hold of this and undo. All right, catheter is in, balloon is up, everything's sterile. She will use a device to attach it to the leg, still giving a little room there. Where does this go?
It goes below the bladder.
Below the bladder.
Assuming.
You'll
Clips
clean
onto
your,
bed.
yep, there actually, these have nice little things right there
Oh,
to
I
click
see
to.
it. Yeah,
Yes.
okay.
All right. So what would we document? What are we gonna document?
Patient tolerance.
Patient tolerance. What about the skin?
Is it irritated or?
Yeah, we can put if the labia or anything is irritated. What are we gonna, document about this catheter here?
Date it was inserted. Fluid.
14 French, so they know the size.
Oh.
5 ml balloon. That way, when they go to take it out, they know they must get 5 mLs out. So how our patient tolerated? What else do we want to know? What's in that bag?
Color of the urine?
Color?
And then,
Odor.
Well, we can't smell. It's in that bag.
Oh.
Color?
What's that? If it's like cloudy, I forget the word.
Cloudy,
Consistency.
clear, sediment. What else?
How much?
How much?
Good.
Did I get 300? Did I get 1,000? All right. Now I need to get a sterile urine specimen to send in this. How do I do that? They've had this Foley in for a day. How do I get this specimen?
Clamp it.
Where am I clamping? That's what attaches to the bed.
Oh.
You curl it, remember, and attach that to there.
Where's the clamp?
So you would need to bring a clamp, which is one on that Foley up there, to the room. And I'm gonna drain and make sure I get all this old urine out of here. Then I am going to clamp right below my port, and that's what that port is. I'm gonna wipe my port. I'm gonna take my syringe. I'm gonna push down in that port. Okay? And it's a hard push. And then I'm gonna pull and get all fresh urine. So open. I'm gonna maintain this in an upward position. I'm gonna put in. I'm gonna recap, and this is ready to go to lab. That is not part of your checkoff,
Yeah.
but this is to help you with the lab sheet today,
Okay.
what these things are.